This video mainly introduces the collection and detection process of eye, oral, and nasal discharge swab samples of InCycle nucleic acid analysis system. 1. Checking and preparation. Open the kit and check if the components are complete according to the instruction. Before conducting the test, mix the magnetic beads well by gently shaking them. Tear open the packaging bag of reagent to check appearance of lyophilized PCR reagent. Avoid using the moisture-absorbed reagents as shown in the picture. Next, gently flick the lyophilized PCR reagent to ensure it is located at the bottom of the tube. Check for the bubbles in the PK liquid. If present, gently flick the reagent from the bottom of the tube to eliminate the bubbles. Then, gently flick the PK liquid reagent to ensure it is positioned at the bottom of the tube. The reagent should be completely at the bottom of the tube. 2. Inserting reagents. Align tube 1 with the reagent tube slot. Insert it into the corresponding position of the cartridge and place it as shown in the figure. If the upper and lower edges of tube 1 and tube 2 are flush, you can lift the reagent tube up with your fingers. The firmly flexed reagent tube indicates successful tube installation. Next, tear off the cartridge sealing film and insert the PK into the corresponding position. 3. Sampling and sample processing. The disposable swab should be taken out and moistened with 0.9% sealant solution provided by hospital-owned. Sample the secretion from the upper and lower eyelids and corners of the affected cat. It is preferable to obtain purulent secretion from the patient's eyes if present. Then, sample the patient's nasal secretions into the sample preservation solution. Thoroughly moisten the head of the disposable swab and remove it. Note, the sample preservation solution is irritating, and disposable swabs should not be sampled again after being mixed in the sample preservation solution. Next, take a new disposable swab and dip it into the patient's mouth to obtain oral secretions. Note that before sampling, feeding should be prohibited for 1 hour to avoid picking up food residues. After thoroughly mixing the disposable swab in the sample preservation solution, remove it, tighten the cap of the sample preservation solution tube. Place it in the centrifuge, and centrifuge at 4,000 to 8,000 RPM for 1 minute. 4. Adding sample and testing. Take the supernatant from the preservation solution tube to a 200 microliter mark. Add the supernatant drop by drop into the groove of the cartridge sample compartment. Click the red exit button to exit the sample drawer. Place the cartridge in the analyzer in the order of left sample compartment, right PCR. Hold the buckle to the right. Click the red exit button to enter the sample drawer. And click Test followed by Next. Before testing, swipe the RFID card in the card swiping area on the side of the analyzer. When swiping the card, keep it stationary until the beep ends. After successfully entering the information, confirm the sample type and other basic details. Then, follow the analyzer prompt and click the button in sequence to start the test and proceed accordingly. 5. Threshold adjustment and interpreting the results. After the test, review the amplification curve. If threshold adjustment is necessary, please please refer to the threshold adjustment operation video. After confirming the results, click Audit OK. Subsequently, you can view and print the test report in the InHub software. Note: only approved results can be viewed and printed. 6. Cartridge handling. Click the red Exit button to exit the sample drawer and affix a seal sticker, yellow, to the surface of the cartridge. Then, put the buckle to the left to remove the cartridge. Use the cartridges should be handled in accordance with the local regulations of pollutant treatment processing. G-Links. Everything is for life.